Hello, I'm Harlan Krumholz, a cardiologist and researcher at the Yale School of Medicine. Welcome to my podcast, Never Delegate Understanding. The title of this podcast comes from the world of furniture design, believe it or not. I first found the phrase when I was reading about Charles Ames, an iconic designer of chairs and furniture. People would ask Ames, "How did you get so good at design?" And he would say, "I never delegate understanding." Immediately upon hearing this, I related this to my work that seeks to put people in a stronger position with regard to their health and healthcare. In medicine, it often seems daunting to try to understand what's behind the conclusions and recommendations of the healthcare professionals around you. Healthcare decisions often have major consequences, and the details often seem complicated. After all, doctors and nurses go to school for many years to learn about the art and science of medicine and nursing. And yet, in my experience, it's often vital that people lean forward into these decisions. Time and time again, I've seen remarkable synergy between an informed patient-practitioner dyad. Engaged patients can bring insights that would otherwise have been missed. And patients certainly bring wisdom about themselves. Not everyone is the same with regard to what's important to them. Almost all important medical decisions are highly dependent on each person's preferences, values, and goals. When I read Ames' words, I thought about the meaning for people facing health challenges. The words, in my view, are not meant to be defiant or confrontational, but rather simply factual. They express a philosophical approach to solving problems. You can respect expertise, but you should also be able to understand the key issues in any health decision. You should never delegate understanding. Ames and I may have been separated by time and fields, but his words really resonated with me and have power even today. I want to show ways that people can understand their health and healthcare. I want to give visibility to people who have exemplified the Ames approach, and it's made all the difference to their lives and their health. Over the next group of episodes, we will hear from patients who have started health data movements, traveled the world helping to engage other patients, and formed online platforms to support each other. People who lean forward, people who have helped others. Not every patient can or will become this involved. But what's most important is that these patients will show us that when it comes to your health, to your body, you have the right to decide. You have the right to ask. You have the right to never delegate understanding. Ames was visionary in design and design thinking. He's an icon in his field. And maybe medicine is now ready for his approach.